Welcome and thank you all for joining us for the Lutzker Lecture, funded through an anonymous donation to the School of Public Health. The Lutzker Lecture Series, allows the School of Public Health to host an eminent scholar in public health topics such as violence prevention, child maltreatment, and child well-being, as well as intellectual and developmental disabilities. In addition to that, areas of focus include child welfare, policy, and advocacy. We are proud to host Dr. Judith Carta today as the featured speaker for this lecture series. At this time, it is my distinct honor to recognize and introduce the person that this lecture honors, Dr. John Lutzker. So Dr. Lutzker he's a distinguished professor emeritus, is the former and founding director of the Mark Chaffin Center for Healthy Development here in the School of Public Health at Georgia State University. His contributions to the school have been invaluable. Through his grants and contracts and the totality of his work, he elevated the Mark Chaffin Center for Healthy Development to a university research center that is committed to the promotion of health, safety, and well-being of children with and without disabilities and their families through research, service, and advocacy. He has dedicated his academic career to advancing scholarship in the service of preventing child neglect and is internationally recognized as an expert in the field of child maltreatment. He's responsible for developing one of the few evidence-based child maltreatment and neglect prevention programs, Safe Care. And it's been implemented through the U.S. And internationally. After obtaining his PhD from the University of Kansas in developmental and child psychology, he went on to earn numerous awards recognizing his contributions in academia. And this was at a number of different academic institutions. In addition, he distinguished himself through federal service through his work at the Centers for Disease Control and Prevention. Impressively, he's authored over 180 published articles. He's delivered more than 485 presentations nationally and internationally. He's written 9 books, and he's participated in interviews for NPR, ABC's Good Morning America, and served as a consultant for 60 Minutes, among the many things that he has done and contributed to the field over his career. So please give Dr. Lutzker a warm Georgia State welcome back home.
Thank you, Rodney. I just need to acknowledge that all of the accomplishments of the Mark Chaffin Center for Healthy Development was my not getting in the way of truly spectacular colleagues and students and staff. It's such an honor to introduce Judy Carta. Judy got her bachelor's degree in psychology at Bradley University, which has long been in the Missouri Valley Conference, just in case you need to know that. She got her master's in human development at Purdue University and her PhD in special education at the University of Kansas, where she hung out a lot in the Department of Human Development, from which Kathleen Baggett, the interim director of the center, and I got our PhDs. So rock, chalk, jayhawk, Kathleen and Judy. So Judy, if I could see my paper here, is currently the Associate Director of Juniper Gardens Children's Project. She's a professor of special ed at the University of Kansas and a senior scientist in the Institute for Lifespan Studies. Her science focuses at Kansas. Her studies focus on developing strategies to minimize the effects of poverty on children's language and social outcomes, developing practices that teachers and parents can use to promote children's early learning, particularly with vulnerable populations. She's also, by the way, been at Juniper Gardens, which is a spectacular research center affiliated with Kansas and Kansas City that has, is it pushing 60 years old? Yeah. And she's been there for 34 years and really mentored Kathleen, and then Kathleen became a colleague. And Judy's work is involved with achieving population-level outcomes in health and education. Achieving population-level outcomes in health and education is a worthy but often unmet goal in our communities. While knowledge about evidence-based practices to achieve population-level outcomes is often available, translating this information to reach population-level outcomes is still a distant goal. In this presentation, Dr. Carta will describe citywide initiatives to promote nurturing language environments for young children in high-poverty communities and identify strategies that have been employed for strengthening and evaluating collaborative partnerships. She will conclude with the promise these strategies offer for promoting community-wide engagement and making a difference in the lives of families and children. And you can see that she would just as well fit in public health, and you can see why Kathleen was such a perfect fit for MCCHD in public health. Judy does big work, and she's somebody largely trained as a behavior analyst who doesn't speak that geeky language of behavior analysis, as Kathleen and I try not to, and try to look at very big picture, and it's truly an honor to have Judy here. Thank you.
Well, good afternoon, everyone. It really is, it's truly an honor to be the Lutzker Lecturer this year. I practiced saying that very carefully. I was thrilled to get the invitation because John has been so important, not only for his scholarship, but for his leadership and creativity in the development of the Chaffin Center, and his mentorship and guidance to so many in the fields of public health and prevention of child maltreatment. But what's most significant is how all of this has resulted in healthier and safer lives, really for generations of the most vulnerable children in this country. And that is indeed a legacy. Your work, John, has had a profound influence on me over the years, and so it's with deep respect and humility that I share some of my thoughts about evidence-based prevention as a tribute to you and your accomplishments. So on we go. What I want to talk with you this afternoon is about promoting community-wide engagement in evidence-based prevention. And as John said, I have not been trained in public health, and so it has been interesting for me to reflect really on my career and to think about the fact that I really am a prevention scientist and have really taken kind of a public health perspective as I venture along this journey in terms of figuring out how to really make an impact at the population level on children's outcomes. Alrighty, let's see. I'm not sure why it's not advancing. So. Maybe now. There we go. I got it. I fixed it. There we go. There's an accomplishment. Okay. So I've spent my career doing my own work in prevention, and the focus has been looking for ways to reduce the number of children who enter school without that quality early experience that's needed to learn to read. So that's really been a key focus of mine. So what I want to talk to you today about is how we can think about using a community-wide, multi-sector approach to bridge the word gap. And I must tell you that some of this is only some recent thinking in the last few years on my part and on the part of my team, as we realize that it takes more than just changing children and parents' behavior, like one parent at a time or one program at a time, we really have to think more broadly about how this change is really going to occur. So what I'm going to tell you about today is the word gap. And I bet many of you have heard about the word gap, but for the uninitiated, what the word gap is a disparity in the early language learning opportunities that are often experienced by children from low socioeconomic backgrounds compared to children from more advantaged families. And this is important for you to know about for a number of reasons, but one is that we know that 34% of American children entering kindergarten today, like more than a third, lack the basic language skills that they're going to need to learn to read. That's sizable, but even to underscore that, 60% of children from low-income backgrounds don't have the skills to learn to read. So it really is a travesty that this is going on. So many people have thought about what are some of the factors that account for that. And one of the earliest areas of research that was done in this area of trying to figure out about the word gap was done by two of my mentors, Dr. Betty Hart and Todd Risley from the University of Kansas, who actually did observational research within the homes of families that were from low-income groups, working class group, and then professional families. And what they did in those days was early 1990s. They went into homes of children who were just beginning to learn language, so from around a little before 1 year of age. And every month they would go into homes and record all the language that children heard in their home environments for a 1 hour sample. And from that, they actually had to transcribe all of that language, and they counted up the number of words that children heard within those 1 hour samples to figure out, if you extrapolate that, what would be the cumulative number of words that children would have heard from the time that they were 12 months, and they did this month by month, until children were 36 months. And so what they were able to determine is depicted on this graph, and that is a widening disparity in the number of words that children heard between the cumulative number of words that they heard and the number of interactive turns that they experienced from the time that they were 12 months to 36 months. And so extrapolating that out to 48 months, they figured that there would be a 30 million word gap between the children of families from professional backgrounds and children from that they called children from welfare families or the lower income families. So 30 million word gap in that early experience, and it just grows wider, as you can see over time. Now, why is this important? Well, it's important because word exposure and interaction experience leads to word acquisition. And so this is a graph that depicts the total number of words that they recorded for children between the age of 10 months to 36 months. And here again you can see a widening disparity between children from the lowest income groups, 525 words, and to the children in the professional families. So children were acquiring that important skill of vocabulary. They were growing more and more different over time. So by the time children were age 3, just entering preschool, the children from the economically advantaged family knew more than twice as many words as the children from the lower income group. So why is this important? Well, this is important because already by the time children were going into preschool, there was inequality at the starting gate for their school experience. So, follow this along and you can see how children who were starting preschool, hearing 30 million words, that having that experience would then demonstrate less academic readiness as they went on into kindergarten, and then lower reading scores when they were in 4th grade, and on through 8th grade. And then in high school, they were much less likely to graduate. So 2/3 of the children who cannot read by 4th grade, 2/3 of children either end up on welfare or in prison. So those are important building blocks that we establish at the beginning that children so desperately need. And so I think what's important here is that not only is there a gap at the beginning, but the gap grows over time, and it grows and extends into other areas. So we're not just talking about academic differences, but then differences that extend into health outcomes and mental health issues as well. So that disparity at the beginning sets the stage for a lot of bad outcomes later on. But I want to get into education here, talking about education. So one of the things that we know is that children who are missing the basic literacy skills when they enter school are 3 to 4 times more likely to drop out of high school. And why that happens is that vocabulary is so critical for gaining later concepts. So one of the things that James Heckman, the Nobel Prize laureate, says is skills beget skills. So children who have the basic vocabulary, the foundational knowledge, will find it easier to gain more complex skills as they grow older and experience education within the elementary grades and in the high school grades. And so children who have stronger skills on school entry have a more favorable pathway toward academic success than children with weaker initial skills. So it's a grim picture, but the good news is we know what it takes to promote a child's early language development. We have the science behind that. We have 20 years of research pointing to specific types of behaviors that we can teach parents and caregivers and caring adults to do on a regular basis that put children on a developmental pathway towards school readiness. And it doesn't cost anything for parents to do that. And these are behaviors that parents and families and child care providers and early educators can do and embed in their everyday routines. It doesn't take anything special other than making a habit of talking and interacting with their children during everyday activities. So I just love this picture. And I show you this slide because I wanted to make the point that back in 2015, the Obama administration, with bipartisan support, took a look at this word gap and this achievement gap experienced by across the socioeconomic levels, and said, you know, we've got this science that we think can make a difference. Let's start doing something about it. And so the Obama administration funded a number of different initiatives around bridging the word gap to harness that knowledge and make an impact at the population level. And so my colleagues and I were funded to develop the Bridging the Word Gap Research Network, and there were several other national initiatives at the same time focused on bridging the word gap, but all of them were developed to see if we could do something about enhancing children's early language environments to improve children's readiness for school. So just to give you a little bit of information about the Bridging the Word Gap Research Network, our goal is to advance a research agenda for reducing that vocabulary gap of young children in poverty by enhancing their language learning experience. And we're funded through the Health Resources and Services Administration. And we consist of about 200 individuals around the country. And what we do is work together to advance a national research agenda to make a difference in children's early language learning experience. And it's an interesting consortium of people from diverse disciplines, from different sectors, like not only researchers, but practitioners and program developers and policymakers, city leaders, mayors of cities, and there are people that work across different kinds of settings, home settings, early care, pediatrics, community settings. So it's a wonderful opportunity to get people who typically work in their own sector to think about how we might work together. One of the first things our network has done is to do a kind of a systematic review of many systematic reviews of, so what do we know about this issue? What do we know about effective interventions that can make a difference? And so in an upcoming, very soon upcoming issue of Early Childhood Research Quarterly, you'll be able to see a number of these research syntheses as well as empirical studies that point for effective ways for promoting children's early language. So we've got that literature out there. We also know from this literature what the active ingredients, or what we might call the behavioral kernels of the effective interventions are. So that's important to know, kind of, if you boil down some of those effective interventions, what are the key active ingredients? And let me point to tell you what some of these are. So both descriptive research and intervention research point to adult responsiveness as the key to promoting children's language. And adult responsiveness boils down to these three active ingredients. First, following the child's lead. Pay attention to what the child's interested in and talk about that. So follow the child's interest. The second thing is narrating children's everyday routines. Just talk about what's going on as the child is engaged in the environment and playing and sitting in the car in his car seat. Talk about what's going on. And then the third thing is taking turns. So the adult follows up on what the child is interested in and what the child might be saying, and follows it up with another response. It's kind of the serve and return kind of interaction, the taking turns. We also, and this is pretty recent, we also now have emerging evidence from neuroscience on the influence of conversational turns on brain development. So I get to show a brain. We're so excited about this. So there's some new research by Rachel Romeo and her colleagues that have actually shown through neuroimaging that children's rate of conversational turns is related to enhanced brain development in Broca's area, the language area of the brain. That's where the informational highway is in the brain. So this is still correlational, but it's still very exciting, and she's seeing this even after taking out the influence of socioeconomic status. So she's controlled for that, but she still sees difference that for children with a lower number of conversational turns per hour compared to those who have twice as many. So the brain is lighting up when there are more conversational turns going on. We talk to parents about how when you talk to your child, you're building the child's brain. And you know what? Now we have some initial evidence about this. Okay, so that's the good news. We've got a whole base of research to build on. But the word hasn't gotten out to people about how important it is to interact and talk with children. Now, some of you might say, really? I was having a conversation with someone on an airplane, this old crusty Gabby Hayes kind of logger kind of guy in Oregon, a few weeks ago, and I was telling him about the research that I've been doing, and about, I go around the country and talk to people about how important it is to talk to your child when they're very young. And he got very emotional, and he said, "People don't know that. That was the most precious time in my life with my young daughter. And being able to spend time and talk to her and interact with her was so important. And people don't know that?" And I said, "Yep, they really don't. Just watch people on their cell phones and, ignoring their children and not talking with their children. They're missing important opportunities for growing their child's brain." But the word hasn't gotten out. And the word gap should be preventable. We have that science, we have this knowledge, but we still haven't been able to close the gap in the quality of early language environments for children from low and higher socioeconomic households, because that word hasn't gotten out. So what we need to do is move the needle on the word gap. We need to do more than just change behavior. Changing behavior is important, but we need to create a culture shift around the importance of talking and interacting with young children. So how do we do that? How do we move from evidence-based practice to creating that culture shift in the way that parents and caring adults think about their role in shaping children's early language? So what I want to tell you in my remaining time is some strategies that we've been thinking about as we've been doing our work about how to create this culture shift. And I'm going to talk about 4 different things, starting with probably the easiest ones to the more difficult ones. So the easiest one is crafting the behavior change message. So I'm going to talk about those 4 ways. So first is crafting the message. So before I talked about the active ingredients, we know what the active ingredients are for bridging the word gap and for promoting children's language. But what we need to do is make those active ingredients as easy as possible for parents and interventionists to understand and remember. So we have to make sticky messages that stick. So a great example of this is Dana Suskind's work on 30 million words. And Dana, for those of you who don't know her, is a cochlear implant surgeon in Chicago. She works at the University of Chicago. And what she discovered in the follow-up of young children who had cochlear implants, when she would meet with them and their parents, she found that there was quite a bit of difference in children who came from higher socioeconomic backgrounds than lower socioeconomic backgrounds after the cochlear implant surgery, after children were able to hear, to have a language environment in which they were able to hear words. But what she realized is that there was something going on in those differing environments that was making a difference for children's longer-term language outcomes. And so what Dana has done is develop a home visiting program and done randomized trials on this home visiting program in which she and her team take the active ingredients about parent responsiveness and make those active ingredients into sticky messages, easier for parents to understand and remember. So instead of following the child's lead, remember we talked about these as the active ingredients, following the child's lead, narrating children's everyday routines, and taking turns, she talks about the 3 T's. Tune in, talk more, take turns. Easy to remember. And so in a home visiting setting, they learn how to do this across everyday routines. So that's one way that we can help bridge the gap. A second way is by engaging more messengers to get the message out about the importance of talking and interacting with children. So what we're doing now in this area is expanding the reach of our message by enlisting more partners, especially non-traditional partners. So who are the messengers? Well, typical messengers might be home visitors, like I just mentioned, and also early educators and child care providers, but also getting into areas like pediatrics and public health, librarians, museums, sometimes barbers. We're giving training to barbers so that they can be talking about that when the child's getting his hair cut. All kinds of folks can become engaged in becoming messengers. So let me give you some examples of how this is working. So the home visitor as the messenger. So the 30 million word intervention at the University of Chicago is this home visiting program, and they send coaches to help parents learn some of these strategies. Another home visiting intervention is Providence Talks. Providence, Rhode Island, received a grant to develop an intervention that would engage the entire community to raise the vocabulary and achievement level of young children. And so what they are doing in a home visiting program citywide in Providence is to teach language strategies to parents, but an interesting aspect of their work is that they use the Lena device to measure children's home language environment. So the Lena device, that little thing in the corner there, okay, is that's a Lena device. It's a device that uses speech recognition technology to record the number of words and interactive turns that a child experiences. So what gets done when a home visitor might be using the Lena device is they have like special clothes, little bibs, to put the recording device, the Lena device, onto the child. And so it can record all day long the number of words and interactive turns that a child experiences. And so what then, the way the home visitor can use this information, that information then can get uploaded, and the home visitor can give feedback. You can see in that the rightmost picture over there, can give parents feedback on hour by hour when children are hearing words and getting interactive turns. So it gives the home visitor a way of really giving the parent some precise feedback on when they could probably do more to interact with their child, like opportunities or times that they're missing to provide more interaction. Child care providers are another one of our messengers. So similarly, the Lena technology is now being used in classrooms or center-based programs. So every child in a classroom on given days might be wearing the device. And a coach working with the teacher or the child care provider would be able to give the teacher or child care provider feedback like this based on what the individual child is hearing and experiencing in terms of words and interactive turns across the day, and also the entire classroom, the whole aggregate of the classroom. So this is a great way for a coach to be able to pinpoint the times of the day or the activities where more opportunities can be provided for giving the child more language and interaction. Another one of our types of messengers are pediatricians, pediatric nurses, and public health nurses as the messenger. Well, guess what intervention this is? Everybody know? Talk With Me Baby. Talk With Me Baby is Georgia grown, and so the Georgia Department of Public Health, the Marcus Autism Center at the Children's Health Care of Atlanta, there are a whole consortium of people from Emory School of Nursing and the Department of Pediatrics, a whole consortium of people have developed this wonderful strategy that they use to engage pediatricians and public health nurses and WIC nutrition providers as a way of getting the message out to parents, typically during well baby visits. The great thing about this intervention is it has broad reach. 99% of all expecting and new parents are seen by nurses during, or pediatricians during the first year of life at regular intervals. And so it becomes a great opportunity to talk with parents about the things that they could do, those active ingredients, tune in, talk more, take turns, and give them, and actually model for them and get them to practice those things within the context of the well baby visit. So that's going on throughout the state of Georgia. So Georgia is like ground zero for this important work, and we're so excited about it. And we're doing it in Kansas too. Okay, so I talked about a number of different types of messengers. But now a third kind of strategy for bridging the gap is to create synergy. So we've got all these different folks who might be messengers, now creating synergy by bringing community sectors together, working toward a common goal. So creating the village, if you will, through citywide campaigns. This is really exciting. So in cities around the U.S., cities are adopting and embracing the idea of weaving early brain and language development into the fabric of communities so that the message about bridging the word gap and what parents can do and child care providers can do about bridging the word gap gets permeated throughout the city. And I'm going to give you some examples. So one of the groups that's been profoundly important in this work is a group called Too Small to Fail, and now it's affiliated with the Clinton Foundation. But what these citywide campaigns do is they help give parents reminders to talk more with their children in all the different places they go in the community. So here's a billboard, and it gives ideas about, let's talk about things that are in the sky. So as parents are driving down the highway and they see this billboard, there are ideas about things that they can be talking about things that are in the sky. And they do this in all kinds of ways within communities. So a kiosk in the bus shelter will have information about things that they're going to be maybe seeing when they're riding the bus. Laundromats now are engaging like laundromat volunteers for bringing books into the laundromat. You know, the laundromat is like such wasted time. You just sit there and watch the clothes go around in the dryer. But this could be great opportunities to talk about the things in the laundromat. Playgrounds and grocery stores. So Too Small to Fail is turning laundromats into places for more conversation. So parents get ideas. They have like signs up in the laundromat about things that they can be talking about while they're doing the laundry. This says, turn wash time into talk time. Play I Spy with your child while doing the laundry. I spy something blue and soft. What do you spy? So a great example. There are also supermarkets in many cities that have become engaged in bridging the word gap. And so they'll put up signs or kind of conversation starters about foods in the supermarket. And there's been some recent research on this, and so Kathy Hirsch-Pasek and her team have discovered that when supermarkets put these signs up in the supermarket, parents are 4 times as likely to engage in conversations with their children. So they do spur on some more opportunities for language promotion. Okay. One fourth and final way that we're working to bring we're closing the word gap is bringing together multiple community partners to create multi-sector collaborative partnerships. So now I'm talking about moving beyond just bringing people together to form more integrated community coalitions. It takes more than a village. So when I started looking at public health, I realized that trying to achieve population-level outcomes is not for the faint of heart. And what I learned, that only 10% of public health measures that are tracked are actually met. Whoa. So that's a little dismaying. So what factors can contribute to some of these poor results? One is when community coalitions come together, many times there's a lack of shared responsibility for achieving agreed upon population level outcomes. So in other words, just getting people together isn't going to cut it. You got to do more than just bringing people together and have a lot of good ideas. Another is that stakeholders often have differing goals or understanding of the problem, so having common goals is really key. But a third, and probably more challenging than all of this, is measuring the accomplishments of what the community is engaged in. So measures of success at the level of the whole community are often lacking. And then finally, oftentimes incentives for achieving population level improvement are missing. They're growing. I think that's happening more and more now, to have incentives for achieving population level improvement, but they're still rare. So some of the work that we've been following about how to be more successful in collaborative partnerships is the work of Steve Fawcett and his group at the University of Kansas. And so he's got a number of recommendations, but I just wanted to point to 3 of them because we have limited time. One is to make collaborative partnerships more successful, we should establish systems to detect progress toward achieving population health outcomes so we can see how those outcomes are growing over time. That's often implemented. But the second and third points are not frequently implemented, and that is developing community action plans that assign responsibility for changing communities and systems. And third, establishing participatory evaluation systems for documenting what's going on within each sector within the community so that there's an accountability of what's happening across sectors and an opportunity to see, I'm getting ahead of myself. So how do we coordinate these multi-sector interventions and evaluate the process? So let me tell you what we're doing with the Bridging the Word Gap Research Network in starting to build a multi-sector approach. So we're working with the University of Kansas Center for Community Health and Human Development, and we've developed a conceptual model about how the community-wide ecological theory of change might work. And we're developing a system for monitoring change in actions that are taken within each sector that link those accomplishments to population level outcomes and creating a community-wide action planning guide. So I just tell you that our conceptual model is in this paper that we published in 2017 that describes this public health prevention intervention approach. And just to give you an idea of the kinds of sectors we're working with, you can see here that some of the sectors that I mentioned already in my previous comments, the pediatric sector, the home visiting sector, library, museum, the faith-based sector, media to get the word out about the word gap, childcare, higher education, the business community, and city government. So all of these are potential sectors. So what we're doing to advance this work is developing a community action planning guide for bridging the word gap. So what this essentially is a blueprint that communities can use when they bring together multiple sectors to work on this issue of bridging the word gap in their communities. And so what it really is a step-by-step blueprint for each sector so that within each sector, we outline the range of programs, policies, and practices that could be used within their sector. So it's a great guide for cities who want to work in this area. And we're beginning to get calls from different communities. Next week, I'm going to Shreveport, Louisiana, and they said, we've got this issue in our community. Help us figure out how to get the sectors in our community to work together toward making change. So the action planning guide takes a community right through gathering information, doing needs assessment, finding out what sectors they have available and what the sectors might be able to do, and then do some strategic planning. But then also connected with this action planning guide is a tool called the Community Checkbox, an online system for recording and monitoring change within each sector. So each sector records the accomplishments that they make in developing new programs, practices, policies, and they get and what that online checkbox allows for is the recording of accomplishments and descriptions and dates coded by their type and their importance. And so what it is a measure of the implementation of what they said that they were going to do. And it provides then that community group with data-based feedback for figuring out where are our sectors falling short, where when we put in resources within a sector, do we see an increase in accomplishments? So it's a database way of tracking what's going on and making changes. And so at the same time, what we're tracking is progress toward those population level goals. So what we're doing then is aligning these accomplishments across sectors toward increases in achievement toward the outcomes that we want to be able to attain. So some questions we can address with this is, how extensively are these strategies getting implemented in the prioritized sectors? What resources have been leveraged to support the community initiative, and how do they make changes in the sectors? What changes in practices and programs and policies have resulted? And how are community-level changes across the community linked to child and family bridging the word gap outcomes? So some of the future direction for this work is carrying out rigorous studies of this multi-sector work. That work still has to be done. And then also replicating these multi-sector interventions across multiple communities. Communities are lining up to try this out, so all we really need is the funding to be able to do this. So it takes more than evidence-based practices to bridge the word gap. You know, it takes more than what we typically have been doing. We need, first of all, systematic approaches for scaling up those practices. We need new approaches for making the practices easy to remember and implement and embed into families' lives and caregivers' lives. We need those new messengers for getting the word out so that all parents are reached in innovative ways. And we need new ways of getting partners from all across the community to plan together and work toward achievable goals and monitor their progress toward their goals, toward population outcomes. So can we bridge the gap? Maybe that's the question we all have. It will take a village, but it will take more than a village. It's going to take the commitment of partners working together in smart and new ways, focused on common goals, learning from each other, learning from their data, and figuring out what's working to foster the success of those collaborative partnerships. So this is our vision for evidence-based prevention of the word gap, and beyond that, for improving population health and health equity. That's it.
Thank you so much, Dr. Carta. We're going to take a few questions. I will say, as a parent of a almost 3-year-old, if I remember it correctly, it was tune in, talk more, take turns.
You remembered it.
All right.
All right.
So I'll try that this evening. I have a feeling my son is going to look at me and say, "Daddy, why are you being so talkative?" But I'm gonna give it a shot. So let's go to questions. Do we have any questions for Dr. Carta? Okay, right here.
So I really like what this program is doing as far as research. Probably the best thing I've ever seen in developmental psychology, and community psych as well. But what are you doing as an alternative versus trying to fight over funds? What's being done?
Well, I'm not sure that I understand your question, but what's being done? Are all those interventions?
Because you guys are talking about funding, what are you doing as an alternative where you don't have to spend money?
Well, I think, so if you don't have money to spend, what do you do? Is that the essence of your question? Okay. Well, so what we don't have funds to do right at this point is to do the research, but there's ways to still implement these strategies and practices. So, we're learning that we can, for instance, we can go over to the pediatric sector and talk to the nurses at Children's Mercy Hospital and tell them about these evidence-based practices that they can put right within their well-child visit. So there's when people hear this message, they get it. They understand the need for it, and they're willing to make changes in the way they typically do things. Yeah.
Thanks, Judy, for a great presentation. I'm curious, you talked a lot about cross-sector collaboration and involvement. One of the things I think happens is that sectors get focused on the outcomes that they're interested in, and I think as you presented it, the outcomes that would be most appropriate for this kind of intervention are sort of housed within the educational sector. I'm curious if you've had any experiences with other sectors, child welfare, public health, medicine, where have you had any difficulties getting them interested in this outcome, and how that's unfolded? What advice you have for those of us who are working in our sectors and trying to work cross-sector?
Yeah, that's a great question, Dan. And let me just give you an example of the health sector. So the health sector is one that we've been very interested in engaging. And so just a real live example, when we went over to the Department of Public Health and told them about this, they were very eager to join us in this, and they were interested in having us embed Talk With Me Baby into that. When we went to funders, our local funding agency, to get funding for that, we went to the Kansas City Health Foundation. They had difficulty understanding how language, they have so many other important initiatives that they had difficulty hearing that working on this would help improve the health outcomes for kids in the community. They didn't prioritize that. So we're working on that. We're working on that, right, Jennifer? We're putting together information about how the word gap affects health outcomes, because it's clear, and so we need to be able to more carefully articulate the connections between the word gap and important health outcomes and welfare outcomes too. Yeah. Yep.
I have a question about your interaction with the American Academy of Pediatrics.
Uh-huh.
As a physician, we get a lot of evidence-based new practice guidelines, and it seems like, especially coming from the national medical societies, these kind of things are very good at helping transmit this to the physicians and the other Academy of Pediatric Nurses.
Yep.
I'm just wondering, because it's fascinating what the individual's going. Is it going on at the national level?
Yeah, actually, the the former the former president of the American Academy of Pediatrics is one of our key members in our pediatric sector, and so he's been very much engaged in this discussion and in this work. And Reach Out and Read, of course, is another evidence-based intervention that gets done at the national level in the pediatric sector, and that's an intervention that promotes parents reading to their child from the time that they're very young. In my discussions recently with Reach Out and Read, they're expanding that initiative beyond early literacy to more of a language and trying to affect the standard of care so that the importance of early language becomes a regular part of pediatric practice.
Thank you for the excellent presentation. This is wonderful. And we definitely need to get the word out. So I just have 2 questions related to scalability. So how are these, you said that cities are lining up to adopt these, and I'm hopefully all cities will someday. How are they hearing about it first? And second, who is the coordinator? So who's that point person who helps make this happen and gets people in the room?
Yeah, so in terms of how are they finding out about it, actually, Too Small to Fail has like a community citywide campaign toolkit for helping communities engage in those kinds of practices that I described. So you can communities can actually get online and get templates for putting information out. So they're trying to make it as scalable as possible. How to develop all those materials, and so how are they hearing about it? Well, Too Small to Fail has a pretty good campaign for disseminating that information, but also we in the Bridging the Word Gap Research Network are trying to use all our social media and all those kinds of ways to get information out about the different kinds of interventions, be they citywide campaigns or even these more individual parent or child care provider targeted interventions out to people. And then who coordinates, your second question, it could be different people in different communities who are taking the lead. So when I'm going to Shreveport, it actually comes out of the mayor's office that a coordinator exists, and that was true in Kansas City. Kansas City has a citywide campaign, and our mayor decided he was going to be a champion for this. And so what he did was to bring together representatives from all different kinds of, not only agencies, but like the Board of Public Utilities and the library and the museum. And he convened a community conversation to see what we could do as a city. And so every person, every agency that was represented had to get up and make a commitment to what they were going to do. So like the Board of Public Utilities has information in their electric bills about talking with your baby. So we have this messaging campaign called Talk, Read, Play with your child every day. So Talk, Read, Play goes into the electric bill. It's on the bumper sticker of the Board of Public Utility vehicles. So lots of innovative ways. But it's great to have a mayor champion.
This will be the last question. You can yell from back here. There's a mic over here. Actually, bring you this one.
So I have a question about how these strategies you talked about can be implemented in the homes of parents who are busy working like 2 jobs, for example, just to get food on the table, and they might not really have time to sit down or like talk with their child. So how would these strategies be implemented in those sorts of homes? Yep,
I think that's a great question. So the word gap doesn't only result from like not knowing, but also not having time. What we try to do is make these strategies as easy to implement as possible. So whenever the parent is with the child, whether they're in the car taking the baby to a grandma's house or going, picking up dad or starting to get food on the table. When you're getting food on the table, you can be talking, right? You can be interacting. So that's one thing. So making the ideas as easy as possible, so it doesn't take a lot of effort to do that. It just takes kind of remembering and doing that. But then the other thing is, even if the child isn't physically with the parent very often, these are strategies that can be done by anybody who happens to be with the parent. So grandma can learn how to talk, tune in, talk more, take turns. The child care provider, the daycare provider can learn how to do that. So it takes a village of people surrounding the child to create that rich language environment across the day in whatever setting the child is in.
Well, Dr. Carta, thanks so much. Your work here really has illuminated the importance of language, particularly in the early years, and how that connects to so many of the outcomes that we're all interested in. And so thanks for being here. We do have a special gift for you. If I can just get back here and give it for you. Just a gift of appreciation for your lecture and taking time to be here with us, honoring our distinguished professor. Thanks so much.
Well, thank you. Yeah. And thank you all.
At this time, we're going to have a reception just across the hall, so please feel free to join us. And Dr. Carta and Dr. Lutzker will be there as well if you'd like to get a picture or speak with them.
Oh, one other thing, I'm going to make my slides available, and so if you're interested in finding out how to get them, talk to Kathleen Baguette.
Great, thank you.